It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, I want to ask you a question now. Answer truthfully. How many of you out there are 60 years old or older? Raise your hand. Okay, now there's a lot of you out there. I'm going to say this, folks. Please do me a personal favor. Call anyone you know who's 60 years old or older and have them watch the Sam Lesante Show. You know this show is also on the web, on our website, ssptv.com. You can watch it 24/7. This is a very informative show for you today. I'm very honored to have three of the stars of some of our programs. We have Dr. Philip Benyo here from It's Your Health. We have Dr. Joseph Bafil from Feeling Good, and we have Dr. Thomas Kislin here from Eye Care Today. And I'm very happy to have them here. We're going to talk about health care. Okay, and this whole thing started when something happened to me in January, and I'm over 60. I know most of you are saying he can't be over 60, but I am over 60, and I had a little pain in my stomach. And being, you know, the person that I'm the biggest baby, as you all know, I said, well, okay. Well, my wife had to go to Dr. Benyo for something, and I went, and he said, come in here, I want to check your stomach. And he checked the stomach. He said, all right, go up for an exam the next day, and blah, blah, blah. And I ended up in the hospital. The point is, if I didn't go to him when I had those symptoms, something very serious could have happened. And so I want to start with you, Dr. Benyo, okay? First of all, I say 60 years old and older. It just applies to anybody, of course. But you have an interesting two pictures to show us, okay? So let's talk about the very first picture. And Andy, put that up on the screen.
Sam, first of all, it's a privilege and pleasure to be here with you and help you improve your ratings. So that's one of our goals.
I told you guys get more ratings than me, you're off the air, okay?
Here we go back 60 years, and look what happens. There's a fiery redhead, my mother, Catherine Brislin Benyo, who I'll always remember. Upon her passage, you were one of her pallbearers at her funeral. Always thoughtful. And then 30 years go by, and here I am, a practicing physician working at Hazleton St. Joseph's Medical Center, thinking I'll never grow old. And here I am now at age 60. And all of us feel as though we're never going to age, but it proves a point. Sam, we're born, we develop, we reproduce, that's the fun part, and we grow old, and we're going to die. Everyone with the sound of my voice is going to die. And people who are going to watch this program are going to hopefully put off the death and dying process a couple of years. That's the goal.
All right, so here I am, as you know, Phil, a big baby. I went to the hospital that night. Not that it was an ultra serious thing, but you say get up there for intravenousness for the infection. I'm so nervous that my blood pressure is going through the roof, okay, because I'm thinking, oh my God, what if this thing bursts, blah, 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 etc. So the general rule, and you say this on your show all the time, you give a lot of great advice. The general rule for anybody who is 60 years old and older as far as their physical, what should they do?
Well, again, it's just like a car, and some people take better care of their car than themselves. And we, like cars, have owner's manuals that we should follow how many miles we have. And 50 and 60 is when the mileage adds up. Basically, what's going to do us in are two broad categories of illness: stroke and heart attack, and cancer. Barring an accident, if you will, or some ill fact of fate, those are the two illnesses that are going to get us. And that's why we're here today, to talk a little bit more about cancer screening and to reduce your risk of stroke and heart attack, because it's all very simple. It just has to be put out there and followed.
Okay, I'm going to get back to you. Dr. Bafil, Chiropractic Medicine, Feeling Good, another great show that we have on. And every time you're doing your show, you're trying to educate. Chiropractic medicine has changed drastically over the years, okay? Where does chiropractic medicine fit in our general health plan?
Our general health plan with chiropractic is to keep you young. I want to keep you moving and mobile. So, and what Dr. Benyo is saying, we do, you know, we grow up and we eventually die. But the key is we want to keep people moving and functioning properly. So our goal is to keep you young your first 100 years, all right? So the fact is the most common disability after 50 is spinal disorders. So we want to make sure that the spinal segments within our body are moving functionally so that we can bend, twist, and turn. Without that, we're not able to go play with our children. We're not able to go to work and take care of our families. So we want to make sure that our spines are checked properly. We don't want to drive the car. I love the analogy. We don't want to drive the car until the indicator light comes on that there's a problem. So preventatively, let's get our spines checked.
And we're going to come back and we're going to talk a little bit more about how you do that. And of course, Dr. Kislin, you know, your show, I Care Today, I watch all the shows, incidentally. And I told you about the last show I've seen, and I came to you about a year ago, 2 years, for a routine eye exam. You know, let me go in because I had the LASIK surgery, as you know, with Dr. Bucci. And I said, just go to eye exam. So you did my exam, and you said, Sam, there's something a little here that I want to pay a little bit more attention to. Not that it was ultra serious, but the case was, you know, then you put me on some drops, and hopefully right now we're at a status quo. Okay, let's talk about general eye care and where you fit into this picture.
Well, while Dr. Benyo and Dr. Bafil are keeping people upright, we want to, you know, keep people sane. And, you know, I think it's the same with me as Dr. Bafil, that a lot of times they don't come to us until they have a problem. So their back starts bothering them, they see Dr. Bafil, start having vision problems, and they think they need glasses. And especially in that population, 55, 60 years old, you know, well, maybe I need to change my prescription, but we really start worrying about cataracts, glaucoma, macular degeneration, and dry eye disease. They're probably the 4 biggest issues that we deal with over 60. So, you know, it's the preventative medicine mantra, but, you know, a lot of these things now that we deal with have very good treatments when they're caught early. And that's the key. Once we lose vision from some of these conditions, it's very hard to get it back. So diagnosing it and treating it early is really the key.
Okay, now when we get back to you, I'm sure there's a lot of stories you could tell me about people's. I remember you told me one person where you checked their eye, you found something that was rather serious, and they did a follow-up, and thank God they did. It could have probably led in the person dying, as Dr. Benyo said. The whole purpose, I think, here is I'm the poster child, and I've said this many times, I'm a big baby. Okay, I'm a nervous wreck, almost like my mother, God rest her soul. I would say, Mom, what are you worried about? She said one day, I'm worried. I said, why are you worried? She says, I'm worried because I have really nothing to worry about. And that's how much she worried. But anyway, worrying is one thing, but you just then have to call a spade and get these different things. So folks, I'm talking to Dr. Benyo, Dr. Bafil, and Dr. Kislin, 3 very successful shows, and those shows are there to educate you. We come back, I want to get a little bit more specific with Benyo, Bafil, and Kislin as to what they do, okay? And if I could go through all those exams, folks, you can. Stay with us. Welcome back to the Sam Lesante Show, folks. Very informative show. If you're 60 years old or older, it's a must-see show for you. I have Dr. Bafil, Dr. Benyo, and Dr. Kislin on the show today. And you know, their shows are on 24/7 on our website, ssptv.com. Benyo with It's Your Health, Bafil with Feeling Good, and Dr. Kislin with I Care Today, and of course the Sam Lesante Show. We're doing this show basically to bring awareness, folks, of why it's important. Phil, okay, so now what is the general rule of thumb? I haven't been to the doctor, I'm feeling good, and you know the old expression with some of the old people, if it ain't broke, don't fix it, okay? What do you recommend a person of our age should do?
Right. The first thing you need to do for good health is pick good parents. And it's already said and done. Go back to your family history, see what mom and dad had, aunts and uncles, because chances are you're going to go along that same route. But basically, as I mentioned earlier, Sam, stroke and heart attack. It's very simple. We know the diseases that accelerate the chances of stroke and heart attack. They're hypertension, diabetes, cholesterol, and smoking. And that's truly about it. And if you get evaluated for these diseases, and unfortunately they're very common and without symptoms, which makes it hard for me to ask a person who has high blood pressure that doesn't cause any symptoms to take a pill in which they may feel poorly or not. Hopefully we can find a drug for them, and they're out there which don't have side effects that they can speak of. But again, it's very, very hard for me to tell a patient, you got to take this drug when they feel well. But those are the key issues: hypertension, diabetes, cholesterol, and smoking. Under the cancer umbrella, again, it's screening. Go for your colonoscopy. Check your PSA if you're a guy, if you're concerned about prostate disease, and we are after the age of 50 and 60. Don't forget to get your mammograms out there, women, and get a gynecology exam. Again, very simple screening tests will reduce the risk of these diseases sticking their head out.
in your field, you know, I went for my colonoscopy, again, nervous wreck, but of course I went, okay? And the thing is nothing. It's a piece of cake. Even the prep wasn't that bad, okay? A lot of people, believe me, it wasn't that bad. But it's the anticipation. What if they find something? Well, the thing is, well, hopefully they would not find something, but if they did, and like Kislin said, at an early stage, it's a lot better, isn't it?
There's no doubt. And there's a lot of people out there who have polyps or growths in their colons. They don't know it. These polyps and growths are like mushrooms. They're going to grow up and turn into cancer. Completely avoidable. And it pains us to see a patient who comes in with a blockage, metastatic cancer, and they never had a colonoscopy.
Because they felt if it's not fixed, if it's not broken, you don't have to fix it. Chiropractic medicine, okay, so what do you recommend for the first time someone comes in? Because as soon as I think, if I'm not, I come to you once a week or maybe once a month, only because I want to get myself straightened out, which has never happened. But the point is, you know, when they think of a chiropractor, crack me in half, break my bones, you know, et cetera, et cetera. It's a whole different process, isn't it, Joe?
I think most of the people come because they're in some sort of pain or discomfort. And my hope and goal is to get people in for wellness care as well. But anytime someone comes in the office, we need to take that misconception out because they've had a bad experience or someone has told them, oh, they're just going to crack your back and once you go, you always have to go the rest of your life. But guys, let's think about it. Has anyone ever told someone never to come back ever again? We want to make sure that everything stays in proper alignment. So when we come in the office for that examination, we check their range of motion. We see where the restrictions are. We palpate the muscle tissue. We either send out for x-rays or we do the myovision scan to see how the nervous system is communicating with those muscles. And from there, we find out what kind of treatment we need to do for them, whether we need to do something a little bit more forceful or we do something that is light and gentle to get the spinal segments to move much better. So it doesn't have to be that experience of I'm going to twist you like a rag doll and stuff like that. It's not like that. It's very safe, effective, and gentle.
Well, just recently, as you know, our own Annie here, okay, lost 75 pounds on your program. Okay, now who would ever think a weight program would be associated with a chiropractor? And of course, we have many shows. You're talking about a little bit on Feeling Good, and then we did special shows with the girls where we just had the whole feature, which is another part of chiropractic medicine. Dr. Kislin, with the eye, okay, the eye is the windows of the world, okay? How important is it to have just a normal, what is it, you know, I'm watching a show and I'm thinking, you know, I have never had an eye exam for the last 10 years or 15 years. I look good, I see good, like I did. Okay, what happens when I come to you?
Well, you know, we see that a lot, especially with men, because typically men are babies.
Yeah.
The wives push them in the door because they haven't been to us for 20 years. And, you know, we basically not only check the vision, we check how their eyes are moving, we check the pressure in the eye, which is a glaucoma test. We check for cataracts. We look at the back of the eye, make sure there's no signs of macular degeneration, things like that. It's a very simple exam nowadays, minimal drops. Patients don't leave the office sensitive to light like they used to. But what's very interesting, Dr. Benyo mentioned about cardiovascular disease. There's been some recent clinical research that has directly linked cardiovascular disease to macular degeneration. They're tied together. And there's a very strong incidence of macular degeneration in these patients who have a history of cardiovascular disease. So when I see a patient that comes in and they have a history of hypertension, diabetes, stroke, anything like that, we really are focused on the retina. And if we do see these early changes, and again, there's two forms of macular degeneration, which we've talked about. One form we can prescribe some nutraceuticals for to try to help slow it down. And there's the wet form, which there's actually now treatments for, such as injections that we actually do right into the eye. So, you know, that preventative medicine is just so important, and you know, the complete medical history is very important. So the patient comes in, we check, you know, what their history is, what medications they're on, and really what's going on, and then we can kind of tailor an exam basically to that.
So here again, just a simple examination could, if there's something happening, get it right at the start. It helps prevent a lot of maybe more serious things that could happen.
I mean, the case you were talking about is it's not a common condition, but there's a condition where we look into the eye at the retina, and there's some things we can see in the retina that are linked to actually a condition called congenital polyposis, which is where the patient can have colon polyps. And we saw that, sent the patient for a colonoscopy. They had about 8 or 10 polyps. they were at the stage where they were not cancerous, but as Dr. Benio said, those continue,
Wow.
and they're at the level of colon cancer then. So,
And I mentioned that on my show a number of times, just from a simple eye exam. Here we go. This person, if they wouldn't have gone for the exam, God knows, odds wouldn't have been in their favor, that's for sure.
right. And the patient looks at you like you're crazy, but
Yeah.
you know that is with the eye exam, we can see a lot. And when I made the referral to the GI doctor, they got them in pretty quick for the colonoscopy.
Now, I'm doing a special show with you on a new thing that you have, okay? Do you want to talk a little bit about what that show is going to be about? It'll be a special Sam Lesante Show.
Yeah, it's a new treatment for dry eye disease, which again is another condition that's linked to cardiovascular disease, but it's called LipiFlow, which is a treatment specifically for this one form of dry eye, and it's a combination of heat and massage that can really eliminate the complaints that patients have from dry eye. It's a groundbreaking treatment, and we're one of only 4 in Pennsylvania that do it.
Okay, well, we're going to do a special show on that, and then you're also talking about your Eye Care Today show, right? Okay, now we come back, folks. We have a lot more to talk about with Dr. Benio, Dr. Bafil, and Dr. Kislin about general health care. But you getting a picture here, folks? It's very simple. Go and see the doctor, get your examination, get your blood work, go to the chiropractor, see how they're doing, get your eyes checked. It's very simple. I do it, and remember, I'm the poster child for being the biggest baby. You know that, folks. We'll be back after this. I want to talk about something, folks. I want to talk about this. I take a number of these every day. These are the PRN vitamin E's. Yeah, Sammy, what do they do for you? Well, we're going to talk a little bit about them because 3 of these guys promote this stuff. We'll see you in a little bit. Welcome back to the Sam Lesante Show, folks. I have 3 stars on my show today. Dr. Philip Benio, star of It's Your Health. Dr. Joseph Bafil, star of Feeling Good. And Dr. Thomas Kislin, star of Eye Care Today. All of them can be seen on our website, ssptv.com. 24/7 hit shows. You can see every one of their episodes. There's a lot to learn. Last month, folks, guess what? Guess how many impressions we had on our website? 1.6 million impressions. Thank you so much for watching. Dr. Benio, before I ask you to talk about this. Now, folks, how many of you are taking vitamin E's?
Fish oils.
Fish oils, I'm sorry. Fish oils. Are you taking fish oils? Now, go to your fish oils right now, and I want you to do what I'm going to do. Then I'm going to have Benio, Bafil, and Kislin respond as why they recommend this. Take your fish oils, open them up, smell them, take one out, bite it, chew it, suck the juice out of it. Excuse me, don't mean to be vulgar, but I don't ever swallow them because I bite the juice out of them. Do that right now with the fish oils you're taking. Why, Dr. Benio, Dr. Bafil, and Dr. Kislin, PRNs, which is the fish oils. First of all, why are they so important for the body? Okay, these fish oils.
Sam, good question. As we started the show, we talked about being born, we develop, we age, and we die. And if you check the obituary column, as I do, we're seeing people, baby boomers, 50s and 60s, they're dying. And the children are not outliving their parents, almost the first time in history. Why is this? Because our lifestyle is just so pro-inflammatory. It's abusive. We have processed foods. We don't exercise. The environment's a little dirtier. And there's nothing, except for these fish oils, to put the brake on the inflammatory process. And most of the diseases that we talk about and see are the product of chronic inflammation. And Nuprin, Advil, Tylenol aren't going to do it. We need omega-3s. And the ones that they just bit at home and tried to spit out, those are the products that this company throws out. And so you can go to a discount center and get cheap fish oils. You're going to get what you pay for. This company is pharmaceutically graded and distills their fish oils. It's the real deal.
I take 4 of these in the morning. And I take a little, maybe a bonus in the afternoon, bite one, and take 4 at night. I've been taking them for anything with an itis is inflammatory. Okay, chiropractic. How does this help you with yours?
Again, with the anti-inflammatory factor there, with our diets being so devoid of that omega-3, how many people do you know are eating fish at least 3-4 times a week? So we want to supplement that. We're not eating right foods, so getting that into our daily regimen to help reduce the inflammatory process within the body, benefiting our circulatory system, our brain, because our brain is mostly fat. We want to add those good fats back into our body. So it helps out so much, and getting the kids on that too, to help them grow and become smart as they're developing. Very important. My little girl takes them.
Dr. Kislin, I know you've been promoting these big time.
Dry eye disease is inflammatory. Macular degeneration is now found to be inflammatory. PRN makes a product for macular degeneration. It was developed by the retina department at Wills Eye. Evidence-based medicine is what came and developed these products. I had the privilege to actually go to Norway and tour the facility where these are made. And the process is just so different than, like Dr. Benyo said, the garbage that is sold in the United States. And everything that we talked about today is inflammatory based. And like Dr. Benyo and Dr. Bafil said, you know, we're not eating right, we're not exercising enough, and there's so much chronic inflammation is linked to our conditions. Everything is itis, which is inflammation. So the omega-3s can really not only help the condition, but a lot of treatments or medications that we prescribe, it actually helps those treatments work better, more efficiently. So in eye care, if I put a patient on Restasis for dry eye disease and I supplement it with the omega-3s, it makes the Restasis works better. It helps their condition get better faster. And I've had patients get off their Restasis when they go on this. So it's just amazing what these nutraceuticals can do if the patient takes the right kind and the right dosing, which will be recommended by the doctor that they see.
And the three of you have these in your offices, okay? Now, I bite them, but certainly you can swallow them. They, as you can tell, just anyone who smells their own and just do what I do. If you can do that with the fish oils you buy down the street, then you're in good shape. But here again, I found that that these really have been of help to me for many, many years. And before I took this on and promoted them, as you remember, at the time it was Lifeguard, right. And now they changed it to PRN. I tried them for at least a month and a half. And you remember, Phil, you came on, you showed my blood work before and after with the other two that I was taking, and you saw a tremendous difference in the cholesterol, plus helps with other things. We got about 2 minutes left. Give me about 45-second review as to why they should come and see you once a year at least, and what happens when they come and see you.
Again, take better care of yourself than your car. I can replace your car, I can't replace you.
So, in other words, get to your family physician for a general check. In your case, Dr. Bafil?
Plain and simple, there's no such thing as a spine transplant. You can't get a new spine, so we need to keep those spinal segments moving properly.
Do not hurt. The process that what you guys do right now, and chiropractic medicine has come a long way. There's a lot more you guys do, as evidence from the shows, that help with, good health care. Eye care, doctor.
God gave us two eyes, and we need to keep them functioning. We're living longer, and we want to live a longer life that is a productive life. And if our vision is impaired, it's very difficult to do that. So again, finding a condition early, diagnosing it early, treating it early is the key to keeping our vision where it needs to be.
When we look at the three of you today, and I look at three in the success that you're having with your individual shows and giving information out, I just wonder, how you feel when you see someone come in where something's really gone really crazy, where they should have come in and seen you earlier with eyes, with, spinal, whatever case, and health care, where we have the colonoscopies right now, you're entitled to them, where you have eye care, just come and do a general checkup, where you have, blood work that you take and be able to tell a lot of things, okay? I want to thank you, Tom, and you look great. You're losing a lot of weight. You don't lose too much now. You know what they say, fat people get sick, they get skinny. Skinny people get sick, they die. We don't want that. We don't want to see what Phil's doing. But, your show's doing very well, doctor, and keep up the work, good work. Dr. Bafil, feeling good. You have a great co-host, I want to tell you that. She's a pretty-looking girl, I'll tell you. Could you fix me up?
She's the brains of the operation.
That's right, she is. And Philip, of course, did your health. You've been on from day one with us, okay? And, of course, the ratings have been really good, only because of what you guys are saying, giving the information out. Folks, if you're 60 years old or older, do yourself a favor. Get to the doctor, get to the chiropractor, get to your eye doctor, okay? They're here for you. Get a checkup. I did it. Believe me when I tell you, I'm very happy. And if something's wrong, at least you're going to get it before it starts. Remember, 24/7, SSPTV.com. Get your PRN, folks. Take your omega-3s. I take them every day. You just saw me taking one piece of cake. We'll see you next time.